cancer, heart disease, stroke, type 2 diabetes, and lung disease. And those diseases result in over 50% of the deaths in the United States. These diseases impact the quality of our life and the length of our life. They often cause slow, debilitating, and painful deaths. Not to mention, it's breaking the bank with the healthcare cost of treating chronic disease. Our healthcare system has traditionally been built on treating the symptom, right? Not on prevention. Well, we need to change that, and that's what this is all about. Now think about that these 4 diseases are causing over 50% of the deaths nationwide. States vary, and when I first looked at the data for California, I mean, I'm thinking the South, Mississippi, these states are really going to be much higher, and California will be better. San Diego, we can be out. Nope. We were just as bad as kind of everywhere else. And the lifestyle things that we do is really what's impacting it. So think about that a minute. It's not that microorganism that an antibiotic can cure. It's not some unseen thing in our water that may kill us. It's our own behaviors. And when this virus comes along like COVID, it is most deadly for those people that have those pre-existing chronic disease conditions. So scientists have moved quickly to come up with a vaccine for COVID, and hopefully we're all going to be getting that very soon. But it's going to take some time for us to really think and turn the ship around on what is creating chronic disease. It is a modern disease that's caused by many things in our daily lives. I mean, just think, kids don't really walk to school anymore. They're not eating as healthy a food. Children have the highest obesity rate they've ever had, and type 2 diabetes in children is an epidemic. For the first time ever, they're predicting that children won't live as long as their parents. And all that just goes up. We get in our car to get somewhere. We don't walk as much. We don't eat as healthy a food. I mean, there's just so many things that add to that. How much worse can it be that instead of eating fresh stuff out of our garden and healthy, we are hopping in our car and going to a drive-through fast food restaurant? We don't even get out of our car to get unhealthy food to eat. And now all of this stuff has been exacerbated with COVID. Now we don't even go get in our car, right? We're getting it delivered, and it's just easier to do. So we have to make a commitment that we are going to create communities and places where we can age well. But what's really important is, what is your plan to age well? Do we all have a plan in place that will impact this? Science and data tells us a lot about living well and healthy aging. The opening of the different things we're doing and how we're trying to figure it out. And we're going to come through this. We're going to be resilient. We're going to come through this. But we should have resolve that this has been a renewed way for us to be healthy. We used to believe that how long we lived and how well we lived was pretty much the genes we inherited. Now, data, science, and will tell you it's really only about 7% of the genes that determine how we're going to live and how long we're going to live. 93% is determined by our lifestyle choices. So we got the steering wheel now to decide what we're doing. And in fact, you know what's a much bigger factor than genes is who your life partner is. If you become a life partner with someone who has healthy habits, you are much more likely to live long and be healthy. So all of these choices we make along the way have a big impact. I want to share some of the information that I've studied. I've brushed up, looked at new stuff for this, and it was very exciting because this is a field that's changing rapidly. I'm going to give you my cliff notes from some studies and experts, but I hope you'll dig a little deeper in this and take a look. I want to start with Dr. Sanjay Gupta's, excuse me. He is a neurosurgeon and quite a famous journalist with CNN. His new book is called Keep Sharp, which highlights the research and findings on brain health. It pulls together data and research from all around the world about how we can keep our brains sharp. I know for me and probably most of you, one of my biggest fears is losing my mental abilities. My mother had Alzheimer's. And for many years, I thought, well, I'm destined for that. I don't believe that anymore. There's a lot of new research in this area, and there's a lot of good news. Our lifestyle choices have tremendous impact on our brain and how our brain ages. We can and do generate new brain cells, and we can make that happen at a faster rate, an accelerated rate. What's good for the body is good for the brain. Dr. Gupta emphasizes that the health of our brain in our later years is often driven by our lifestyle choices in our earlier years, even decades earlier. So one of the things they find with dementia and some of these things, by the time it's diagnosed, you really can look back that they've had it for maybe 20 or 30 years. But lifestyle choices can drive, how that is how we are impacted by that. He actually calls it brain resilience. So you really can, there is no pill to take for Alzheimer's right now, or for dementia, or for any of that. But you can drive that again by your lifestyle choices. Dr. Gupta, and his book is a great read. I really enjoy, I listen to his audiobook, so it's like he's telling me about this. He gives us 5 important points. His first point, and he says his number 1 point, and the most important thing we can do for good health, is exercise. He emphasizes both physical exercise, planned activities, strength-based, flexibility, interval training, but also physical activity and the importance of having physical activity, movement in our lives, both regular and different. So regular is important, to do it on an ongoing basis, but to shake it up, that we shouldn't get in the habit of here's what we do and here's what we do every day. We need to change it up. We need to stretch new muscles. We need to do new things, cardio, strength, flexibility, all of those things. And as we build that, it's what helps our brain as well as our body. When it comes to exercise and physical activity, I think we all know we have to find what works for us individually. A lot of this, and maybe we've all tried different things. I had a gym membership for a while. I just didn't like going to the gym, just different things. Now, one of the things that I've found with COVID, I've found some great online stuff to help work and do things and find things that I like and where you get there. I tend to like to do some running and even walking. Dr. Gupta talks about how effective walking 3 or 4 days a week is. He encourages 150 minutes a week of some kind of activity and different activity. This is the anti-aging pill, is exercise. And if you remember with Live Well, one of the 3 behaviors was lack of exercise leads to the disease and is killing us. Or we can exercise, have movement, fix a lot of physical activity. It makes us healthier and we live longer. So that path split is very clear. And the choice is ours. So we just got to make it happen and get there. For so many reasons, this is so important. By the way, gardening, dancing, all those things are activities. Movement is important. Dr. Gupta's second point, he calls discover. Active brain stimulus is critical to generating new brain cells. He really warns against retirement, early retirement. He says, work at a job you love as long as you can. But when you do retire, you've got to find new purpose and brain stimulation. And that is very critical as to how we move forward. And in the same way we talk about physical activity, it needs to be different. We need to change it up. He talks about how great, crossword puzzles are. Don't do those every day. Do something else. And he uses this term several times. Get outside your comfort zone. Think about learning a musical instrument. Think about learning a language. Doing anything there that really stretches our mind and challenges us to learn new things. And I think those are things, again, we have to find what works for us. Some of those I think about and think, whoa, I'm not sure I could do that. But you know what? Try it. See where we're going and where we go. Third thing he talks about, he calls relax, and it is the critical importance of sleep. Lots of new research and data on sleep. I mean, I used to have a job with that I had long commute, long hours, and I got 4 or 5 hours sleep a night. And I'd say, sleep's a waste of time. Well, that was very, 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 very wrong. Sleep is what regenerates us. What gets the garbage out of our system and our brain. And we need to learn to have good, solid sleep. And our lifestyle choices impact how well we sleep. If you're overweight, obese, you're not going to sleep as well. All of that becomes unhealthy cycles. So those same lifestyle things will make you healthy. Dr. Gupta has a lot of recommendations about how to get good sleep. He also talks about the importance of relaxing during the day, finding a time to meditate, relax, call a friend, have a cup of coffee with someone, ways that you calm and relax during the day as well. His fourth point is nourish, he calls it, a healthy diet. You have to, what are we putting into our body and our brain? Overeating, if you remember, it too was one of the 3 things in Live Well, those behaviors, bad diet that's leading to, down that path we don't want. And healthy food is the other. He talks a lot about good things. I think we all know vegetables, fruits, some of those nut things like that are so healthy. But, the direction of trying to eat less red meat, those things are important. He talks about something very important, though, about what not to eat, and he really stresses sugar. Sugar is really a culprit. It leads to inflammation. It is the food for inflammation, and inflammation is what's leading to all kinds of physical ailments, brain disease, and dementia. So, and as we know, there is sugar in a lot of places that we really have to learn how to limit that. His 5th point kind of ties all this together, and it's about connect. Social connection is vital to both our physical and our mental health. Isolation is a public health crisis. Many of the modern factors in today's world creates isolation, and it's contributed to this crisis. And of course, COVID has done that even more. It's a sad irony that in these days of great communication, many, many people find themselves lonely. They estimate 1 in 5 Americans are lonely. We need to keep in mind how important it is to have these connections. How do we nurture them? And they're not just nice to do, they're critical for our health. Dr. Daniel Lieberman is I have to look at this, paleoanthropologist at Harvard in biological services. And he's done extensive worldwide research, really, of the human body and head, and is the author of a new book, The Science of Physical Activity, Rest, and Health. He has studied a lot of certain tribes in Africa and in the Amazon to look at their human body and aging and brain. He really concludes that our chronic disease is a modern Western problem that is caused by our lifestyle choices. He did not find 1 case of diabetes or heart disease in Africa or the Amazon. And look where we are in this country. He describes 3 important things for good health. Number 1, physical activity. He really emphasizes movement, physical activity, movement. As we age, our muscles will atrophy. We become frail. If you let that go too far, you won't be able to get up and off the toilet. I mean, these are things of dignity and health. This can be reversed by physical activity. It counters inflammation. Muscles produce something he calls, look at this, biokines, which actually turn down the inflammation in muscles. So it helps prevent. So if we exercise and generate that in our muscles, it will help prevent diabetes, cancer, obesity, hardening of the arteries. Here's his sentence. It is extraordinary how many benefits we get from moderate activity just from turning on your muscles. Think about that, almost everywhere. He also stresses too much sugar in our diet is killing us. He said it adds weight, and when you add weight, your cells swell and they don't function properly. And they're kind of like a broken balloon.